According to the World Health Organization, more than 106 million babies were vaccinated worldwide in 2008, an all-time high. But some parents are still wary about getting their children immunized against diseases. February's issue of American Baby magazine looks to put their worries at ease. And joining us now with more is Amy Gorin, health editor for American Baby. Good morning.
Good morning.
So this is sort of a list of things that you should know about vaccines before you embark on them. And it's a great list. So the first one you say is infectious diseases are rare. How does that play into vaccines?
Well, they're rare because so many children are vaccinated, but illnesses like the mumps and the measles still exist, and the world is a lot smaller than we think. So if your friend takes a plane ride to Europe and encounters someone with the measles, comes back and plays with your baby who's not immune, who hasn't had a vaccine, then your child can catch the measles.
And so not vaccinating your child can potentially affect others then, right?
Absolutely. So there's something called herd immunity, which a lot of parents rely on, and that means in a group of people, if 90% of those people are vaccinated against a particular disease, the remaining 10% are considered safe. But the problem is that barely ever happens. When do 90% of a group of people do any one given thing? So you can't rely on your neighbors and your friends to protect your child. You really should vaccinate your children.
I've heard that in New York we actually have that herd immunity because we're so packed in with one another. The next thing you say, there's been a lot of controversy about vaccines, but they are considered safe. Tell us about that.
Yes, absolutely. There is a lot of controversy, but doctors for the most part recommend them because they're so confident in the research, the time, the money, the effort that goes into testing them. Clinical trials happen, the FDA monitors the safety of production, and the CDC and the FDA together monitor use and safety. So by the time the vaccine reaches your child, it's gone through so many tests.
I know a lot of people, and as myself included, concerned about the side effects. You hear you get a flu shot, sometimes you get sick, and then there's some other side effects more serious that can happen. Is that a valid concern?
It is, but most of the side effects, they're actually discomforts. We're talking a sore arm, a low-grade fever, and most parents end up thinking that getting that sore arm is worth the worth protecting against the disease.
Because that sore arm can be less than what could happen if you actually get sick.
If you had chicken pox for a week, it would be a lot worse than a sore arm.
Definitely, I had chicken pox. All right, and so next, babies can be vaccinated even if they have a minor fever or cold. So if they're already sick, they can actually go to the doctor and get another vaccination.
It actually ends up being a better thing. If a child has a cold or flu, their immune system is already revved up, so it might absorb the vaccine a little bit better. Of course, if your child has a high-grade fever, you should talk to your doctor about pushing the vaccine back for a few days.
And also, should you listen to your doctor on the vaccine schedule so you know when it's the best time to get each vaccine?
Absolutely. You should use the traditional vaccine schedule. Has been tested and tested and tested, and there's so much research behind it. And the alternative schedule just doesn't have as much science behind it. So when it comes down to it, why take a risk with your baby's health? Go with the traditional vaccine schedule.
All right, great. Amy Gorin, health editor for American Baby. Thanks so much for being with us.
Thank you.